The Dental Download podcast is your source for insight into dental school, conversations with dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Haley Schultz. Let's get into this week's episode. Hello, everyone. Happy Monday. Welcome back to your favorite podcast, the Dental Download podcast. This week's episode is a longer one. It was a great conversation with a fellow D2 at Ohio State University's dental school, Joe. I've actually had Joe Linser on the podcast before, so he's a returning guest, and I really do love having dental students on the podcast because it's much more conversational because I can directly relate to what they're going through and kind of share my 2 cents. So it's a nice comparison of our dental school experiences so far, and the main topic kind of revolving around the first 2 years, those preclinical years, sim lab, didactic classes, struggles, things that have gone well, and how we're feeling preparing to start in clinic with patients in May for both of our programs. So that's kind of the topic of this week's episode. I'm not actually going to do much of a catch-up this week just because the main episode is a little bit longer, but next week I'll be sure to do a thorough catch-up for you all, and this upcoming week it's really going to be a hardcore study week, the week of February 7th, because the following week we have 5 midterms and a tough quiz, and then the week after that I have 2 or 3 more midterms. So it's midterm season over here. We're working hard, and it's all going to be okay though, because once those are done, we have another week of school, and then we have spring break, another month of school, and then all the way around to finals again, and then we'll be in clinic. Time really does fly. The months go by fast, and dental school is going well overall. It's just very busy, but I'm loving it, and I do enjoy being busy, and I enjoy the opportunities that I've gotten through dental school with my extracurriculars, with things like YouTube and podcasting, Instagram, and then of course the main thing about dental school is the school, the opportunities to be learning and advancing so much week to week. Honestly, we get so much great information given to us, and we just try to latch on to as much as we can each week and hopefully build our knowledge a little bit at a time. But that's everything for this week's intro. I hope you enjoyed this week's episode with Joe. The following week is going to be Valentine's Day, as you know, Monday, February 14th. So I figured I could do an episode on relationships in dental school. So you all know I have a boyfriend that I've had for a while now. So yes, it'll be about romantic relationships, having a partner, but also friendships, making friends, keeping friends that you started dental school with, like friends from undergrad or friends from your old job or hometown, and also family. So not just romantic relationships, but that will be our topic for Valentine's Day next week. But for now, let's get into this awesome conversation between Joe and I. Want to make a podcast? Spotify's got a platform that lets you make one super easily and then distribute it everywhere and even earn money, all in one place for free. It's called Spotify for Podcasters. Here's how it works. Spotify for Podcasters lets you record and edit podcasts right away from your phone or computer, so no matter what your setup is like, you can start creating today. Then you can distribute your podcast to Spotify, but also everywhere else podcasts are heard. Video podcasts are also available, and you can earn money in a variety of ways, including ads and podcast subscriptions. Did I mention it is totally free? No catch. I've been using Spotify for Podcasters since the very beginning of my show, and now we're nearing our 200th episode. So I can definitely say it's an easy platform, and I've really loved using it. So be sure to download the Spotify for Podcasters app or go to www.spotify.com/podcasters to get started. Hi, everyone. So I'm back with a familiar voice. We have Joe here again. Joe, do you want to just remind everyone where you go to dental school, what year you are?
Yeah, sure. My name is Joe Linser, and I'm going to Ohio State University, and I am a D2.
Yeah, so today I thought I'd bring Joe back just to kind of compare and contrast our experiences so far now that we've gone through a few more semesters of dental school, and we're both more familiar with how clinic works at our school as well. And since we have one more semester till we jump into clinic, just like how prepared we feel, how our experiences have been so far. So first, I think it could be helpful to just give like a summary of how our school handles clinic versus didactic time with our first 2 years. You could start if you'd like.
Yeah, sure. So the first 2 years is a lot of you're in between preclinic and you're in lectures as well. And you're kind of doing the balance between having all this lecture content to go through and making time to get inside of the preclinic, whether it's, in the evenings or whenever to practice, all to prepare you for competencies and getting into clinic in your second 2 years. And in so D3 and D4 year, then the idea is that you're maximizing the time that you can be in clinic, usually 2 appointments in the day, one morning appointment and one afternoon appointment, with some other classes sprinkled in there. So it's not that you're not going to take any classes, but there will be some. They might be in the morning, they might be at 7:30 a.m., and then you might start your day after that, or they could be an online. Now with asynchronous classes becoming more and more common, we're kind of seeing that some of our classes might just be solely asynchronous. We don't know yet, and everything changes year to year, though.
Yeah, they're telling our incoming D1s, like students that just got in. I'm honestly glad that they're being honest with them, but they're saying that Michigan is going to keep the hybrid model in their dental school. So certain classes will pretty much, as for the foreseeable future, stay asynchronous, which I thought was interesting. But I'm glad they're at least being honest, because I know that's a deciding factor for some students. Some students do like having some online classes. So I think it's good that they're being transparent with it.
Yeah, I really liked a lot of the asynchronous ones. My thing is, I even liked recently, I've noticed how hard it is sometimes to take tests in a room when you're side by side people now, because I got so used to using Proctorio that now every little detail like behind me like is just amplified, which so that's one thing. But
yeah, the bouncing leg next to you, the pen tapping.
Yes, it happens. What about you? What does the clinic structure look like for Michigan?
Yeah, so I'm going to go through like what we've honestly actually done, because what they told us to expect was different with COVID, and our school's under renovation. For people that don't know, it's almost done. It's going to be done at the end of this term, but that meant that our 4 clinics were down to 2 clinics. So that already really affects patient care and opportunities, of course. But the way they tried to combat that is, like you mentioned, your school has a morning appointment and an afternoon appointment. They got rid of the lunch hour, and they had an 8 to 11, an 11 to 1, and then a 2 to 5 slot every day. So now there's 3 instead of 2 per day. And then on Thursdays, they even have a 5 to 7. So they pretty much added more slots to make up for having less clinics. Now this semester, we're up to 3 being open. So that's great. But the reason I'm mentioning all of this is because our first semester, we start early in June. So it's all bookwork. You don't do any sim lab. And then that ends in August. And then at the end of August, you come in and you have sim lab for the next rest of your D1, all of D2. Your first year, you're just learning restorations. And then your second year, where I am now, we're doing crown preps, crowns, bridges, and it's been a lot easier than restorations. And I think it's also because we have improved hand skills. But also during your first year, you have different rotations and kind of like mini sessions. Our class is about 100 people, but they schedule us in groups of anywhere from 15 to 20 to go into a different smaller learning facility in our school that looks just like clinic and has all the same chair setup and everything. And you learn how to assist, you do anesthesia lab, you do prophies on each other, you do basically practicing for clinic, but at least on a real person, and that real person is your classmate. So that's kind of the in between using a mannequin and sim lab. Then we work on each other, and then we work on patients. We don't do any actual restorations or crowns or anything on each other that's permanent. Right. It's all things that are just temporary practice, but we learn how to do prophies and injections and everything. So all of that happens throughout your first 2 years. And then by the end of your first year, you're able to do prophies technically on patients, and you're able to take radiographs on patients. And we were supposed to be doing prophies now, like maybe like once a week or something on patients, but we still don't have any patients of our own. And we do radiographs probably like every couple weeks. You have a rotation scheduled where you go and take all the radiographs for intaking patients before they get assigned to dental students. So that's one of the ways that we're directly interacting with patients starting your third semester of dental school. So the end of your first year onward. And we also assist, which starts your D1 fall. That's what the current dental students are doing. We didn't get assisting until our third semester of first year, just because of COVID and PPE lacking and everything. Right. But they did fix that. And the current first years have been assisting the whole time that they've been here. And that's a lot of our clinic exposure and a lot of us trying to get more comfortable in clinic. Similarly to, like you said, SimLab has those competencies. We call them practicals, but it's the same thing. And you get tested on each of the skills that you're learning, and then you move on to a new skill, get tested on that. And then at the end of our D2 year, right before we start clinic, we have an OSCE, which is like a clinical exam to see if we're ready for patients, but they haven't told us much about that yet. And then, like you said, third and fourth year, primarily seeing patients. Most people, I think, get 3 or 4 patients a week just because they are limiting them because of the limited clinic space. But hopefully when they're open, it'll be more like 5 patients a week. And yeah, clinic. Like you were saying about classes. So third and fourth year, you have classes like 1 day a week, usually Wednesdays. Third year, just Wednesdays, you have class and you don't really see patients. And then fourth year, you only have like 2 classes total. And third year, you have maybe like 4 or 5, but they all happen on 1 day.
I think this semester is when we are going to start doing a lot. We've done prophies on each other, but this year, or this semester, I should say, is when we're going to, at the end of the semester, actually have our first patient, which is going to be like a friends and family day, where you invite someone to come in and you do their prophy and whatnot. And that's like your official, like, first patient that isn't, my student partner or whoever that is getting subjected to my bad perio probing. But
yeah, that's what they said they usually do for us. It just, they don't have anywhere to put us, pretty much. That's what they told us. They're like, sorry, we would love to have you do that, but there's no space because of the renovation. So we'll just be waiting, I think, till we start with normal patients in May, and we'll do exams, prophies, restorations, whatever the patient needs all at once.
So did they just start this renovation?
No, it started before I even started dental school. I would think it was a 4 or 5 year project, but it's almost done.
Okay.
So
well, good. No, we just got a brand new clinic here, and it just opened up. This was this last semester, fall of but it was super nice to be able to work in a new space, and you'll love it. I'm sure it's going to be beautiful. So
yeah, I think like I said, 3 are open now. So we know what it looks like, what it's going to be like. There's just one more that they're finishing renovating. So like as different parts of the building were fixed, like they're open for use. Like they did little parts at a time, since it is still our school, versus I'm pretty sure yours is like a different building, right? Like
it's pretty much a whole building.
Yeah. So that's nice that you could proceed as normal until it was done.
Yes, this is true. Yep.
Like that's a difference, I think, which is nice. But I mean, for me, it really hasn't affected my education too much, because like the only thing I'm really missing out on is like a semester of prophies. And I think we would only do a few anyway. So in the long run, it's not that big of a deal for me. I think for the students that are a few years older than me, it was a little unfortunate, but they knew what was like this. It's on track for what they said the renovation would be. So we talked about like how our schools test us and teach us leading up to clinic. And we both have 1 semester left. Like you said, you're going to do a prophy this semester, but how prepared would you say you feel to like actually have patients in your chair and be working on them?
I think the hardest part of that question is that we don't know what is going to come through the door, as far as, we aren't going to be doing ideal at that point anymore. It will be following the caries, which I feel like we really don't do that too often. We do have some special teeth that are kind of like that, where they tell us there is a carie inside the tooth somewhere, and you have to go and like excavate it. But I feel mostly like we are getting prepared very well. But it's just that the whole thing of like, sometimes you open up a tooth, you might be like drilling out a cavity or whatever, and it's like larger than what it looked like on the radiograph, or larger than, and we've learned about this before, but there's sometimes like a pinprick almost on the tooth, and that's where the cavity's at, but you open it up inside the dentin and it's much more extensive. And then you're like, well, I have to keep going because I'm not going to be able to get any retention or anything like that. So those are the type of things I feel like I know that what will have to happen in that situation, right? But then it's like, thank goodness we have faculty right beside us the entire time to help us, because they will, make sure that we are doing exactly what we should be doing, and making sure that we, even just a simple, like from faculty, like saying, yes, keep going. Like, you're not there yet. Like, you have to keep going. You have to keep drilling. You have to keep getting better retention form, stuff like that. So for the most part, I feel like that is the biggest thing. Faculty not being afraid to ask questions in clinic. You're just still going to have to ask questions. You're still going to be learning. You're still going to be like going through this process of dental school. It's not all said and done with, and you're not like a confident practitioner, or you shouldn't be, at least I hope.
Yeah. Yeah. I feel like we can do so much, or think we're doing so much. Like, okay, I have a patient coming in, they need a class 5 restoration. I'm going to review my notes and like think about how I'm going to do it ahead of time. But then the patient comes and they're like, oh, like I have this sinus thing going on. Can you do one of the other teeth? And like, you have to just appease the patient for the most part. So even if you prepare, things are not going to go the way you're expecting. And that, I think, is going to be one of the biggest adjustments, is just like you said, thinking on your feet, being honest with the faculty. Because at least when I'm assisting, faculty will like, not mean, but they will like grill the students, like, what are you going to do? Why are you going to do that? Like, and it's important to help us critically think and learn how to work on our own. But there's nothing wrong with saying, to be honest, I'm a little over my head right now. Like, can you walk me through how you would do it? And like, faculty might be disappointed if you've been working with them for a while, but at the same time, like, they're going to help you. So it's important to recognize your own limits, like give it a shot and then say, is that what you would do, or something like that. So that's one thing I've picked up assisting that's important to do. And another thing I think I'm most like, it's not necessarily as worried about the actual procedures, because I feel like we have so much repetition practice. It'll be a little different, obviously, because it's real teeth. And like you said, nothing is to like perfect standard or normal per se. But I'm more worried about the medical aspect of patients, and like having medically complex patients, understanding their medical history, their medications, making sure I'm not going to like put anyone in harm's way. I want to like definitely be reviewing some of my pharm, and we have a class literally this semester called the medically compromised patient. So hopefully that'll make me feel a little more confident, but I just want to make sure, of course, that I'm protecting everyone that I'm working on. So that's a little intimidating for me.
That's okay. It would be more concerning if someone said they weren't concerned about that, right?
Yeah.
So we should all be very concerned about that. There's no doubt.
Yeah, for sure. Do you feel like there's anything you're going to do in the next semester to prepare more for clinic? It's so easy to say like, I want to review pharm, like I just said, but there's like no time. So I'll try, but is there anything you're planning on doing?
So with like OSCEs for you is, I think the synonym for us is competencies. So if I'm able to do competencies well, then that's like the sign that you can move on to clinic and stuff. So I'm going to really focus on that, to be honest. And it's actually like, it's coming up very quickly. Actually, by the time that this is posted, it will probably be in the middle of it. So that's very important to me. Other than that, the whole software piece of it, the software that we use inside the clinic, just being more familiar with that is something that we've been working on kind of a lot throughout dental school. So just getting more comfortable with that. But other than that, there's not really too much. We are taking pharm this next semester. So that's definitely probably going to open up my eyes to all of that. Never taking a pharmacology course before, because in undergrad, it wasn't really something you had to take. You could, but it was like, it's not a prereq for dental school. So I really wasn't going to subject myself to that, but it has come back around. So,
Mm-hmm. Yeah, we talked about this last time we recorded, that I mentioned that like OSCE, and from my understanding, our OSCE is a written exam and not a
okay.
clinical exam. But I could be wrong. Maybe it has both components. That's why I don't
That
want to
makes,
talk about it too much, because it doesn't make sense to me if it's not clinical hands-on work, because how can they for sure assess that we're ready? Like, we've passed our practicals first year and
right.
now second year, and that's great. But for me, again, this is optimistic, but I'm hoping I'll go in and practice a little bit more restorations. So that's like prepping a cavity, for people that don't know, and then filling it with the composite, the like white filling, because we haven't done that since first year. So I feel fairly confident with them, even though I haven't done one in a long time, but it would be
Yeah.
nice to practice again. And we have access to this big bin of like extracted teeth, so we can drill on real teeth if we
Oh,
want.
nice.
We did that once for a practical first year, so we've done a few, but it would probably be useful for me to do that a few more times just to get more comfortable. But again, that's like, it feels so far away because we have a really intense semester this
Yep.
time, like way more than the past two of our second year. So it's hard for me to comprehend doing anything beyond what we already have to do, because it's just a
Right.
lot.
Yeah. Time management is going to be a real, maybe not struggle, but something to be mindful about this next semester for sure. There's
Mm-hmm.
no doubt.
So do you get patients in May? Is that when your new semester would start?
Yeah, in the summer we would get, the idea is that you'd start getting like patients around that time, maybe June, but somewhere in there.
And is it just as patients sign up to come to the school, they assign them to you all, or do you get like a fourth year that's graduating patients? How does that work?
Yeah, usually it's passed down, but I don't want, yes, it would be passed down because the D4s would leave in like May, because they would graduate then. So then you'd get some, you know, you'd get some of those patients. But recently what's been happening is, say that you are a D4 and you don't quite have all of your graduation requirements, and you're a D3 and you have a patient that needs like 20 restorations. Well, that patient might need to go to a D4 to get those restorations done so that they can graduate. So although like you will have your core base of patients that are passed down to you, there's always a possibility that you might have to donate, graciously, some of your restorations or some of your crowns to a D4 that is like weeks away from walking out the door. So that's, I guess the
Yep.
pro is there that, they're at least paying attention to that type of thing, and like, okay, we're going to, graduate on time. But yeah, those requirements are a thing. So.
Yeah, it was interesting because I was watching a video from a friend of mine from undergrad, and he goes to Detroit Mercy, and he was saying some of his classmates are third years, 2 semesters in now, and they've done like 10 restorations in 2 semesters. And I'm like, what? And then there's my roommate that's done like so many crown preps, so many restorations. And it's crazy because it's luck, but then like luck of what your patients need, who's in your patient pool. Like, some people's patients are in pretty good health. They just need like perio maintenance, which gets
Right.
you, we call them CEUs, clinical education units. Like, every procedure has points basically assigned to it that you get, and you have a requirement for overall points per semester. And you also have a requirement to graduate a certain number of each type of procedure as well. I'm pretty sure most schools do that, but the scale of what you need differs between schools. But what I liked about our program, and again, like I said, I live with 2 D3s, so it's nice to kind of see their clinical experience. It helps me feel a little more in the know for what to expect. But they have these requirements for crowns and whatnot. And if you don't have a patient that needs it, there's like a request system you go through at our school. And then when they filter incoming patients, they give them to the students that put in requests for like specific things that they need. So as long as you're proactive at my program, I feel like for the most part, you get everything that you need. You just have to be kind of annoying about it, like requesting it over and
Mm-hmm.
over and over. And eventually you'll get the patients that you need to meet your requirements.
Right. There's no need to beat around the bush. I mean, if you need more restorations, I mean, I would be talking to faculty every day I come into clinic, like, still need these to graduate in however long it is. But it's just one of those things. You have to be able to articulate what you need to graduate. You need to be able to, tell, if you're struggling in something, you got to be able to articulate that too. So it's all very important.
Yeah. And I've even heard of some, like, similar to you, the fourth years graduate. And then when I come in and now I'm a third year, everyone's moved up. We get there about 30 patients of a patient family usually. And if I have like a dentures case, but I've already started a denture and we only need like one for the year, you can like you said, give it to a D4 or something that needs it. And then they might give you a patient that needs just restorations and you can get requirements from that. So I've heard a lot of like give and take as well to try to like help each other out is something that happens a lot, but usually all the patients stay with you the whole time for the 2 years,
Yep.
but it just kind of, like you said, the little requirements, they might jump
And if you
around.
have a patient you really like, you're going to want them to stay with you also. So that's
Yeah.
something else you've seen. I've seen like what do you like want to call it? Patient loyalty. Like they like coming to see you and whatnot. And there's a few people where you're like, I can always rely on them to like show up and stuff. And that'll be very, very good.
Yeah. I've heard a dentist that I follow said like 2% of your patients will cause like 90% of your problems. And I'm like,
Oh, that's so funny.
That's very true. And
yeah,
private practice, you do have the ability to dismiss patients, which is nice.
Yeah,
I guess
you do.
even in the dental school, you do. I've heard of more so, not so much patients like just being annoying because you can't really do much about that. But if there's been patients that have been like inappropriate to students, or if you no show, I think 3 times, then you get dismissed as well.
Yeah.
So there's certain procedures for that as well. If people are really, really uncomfortable or just don't respect our time, because it's really hard, like I said, to get clinic appointments right now for the students. Like they have 3 or 4 per week, and if someone doesn't show up, they're in a big trouble because they have requirements of points they need to meet each week. And if they're missing an opportunity to get some, their grade goes down, which I think is a little weird that our procedures you do in clinic determine your grade, because we don't have control over the patient's needs. And one of my friends we have a program at my school where you come in and you either choose to take elective classes or you choose to do a research project. I'm in the elective classes. One of my classmates is doing a research project about this topic of the CEUs. And does it make students kind of overdiagnose? Does it make students just not have the most ethical mindset because we have these pressures of performance and grades determined by how many restorations you do in a week? But if the patient doesn't need restorations, you don't want to be diagnosing that they do, kind of thing. So she's comparing like a bunch of dental schools. So I'm interested to see where her project goes by the time we're done, because I think it's a very interesting topic. But
it's a real ethical concern. Something that, I will agree. It'll be interesting to see if it's going on or not. But yeah, I agree completely. It's very concerning ethically. And yeah,
that's why I also, for a few reasons, I'm happy that we have the mannequin dental boards now, at least in my state, just because you find this ideal patient and then you might find them now, and then a patient might save them until March to do their boards on, which is just not, you want to treat, if someone like dental caries is disease, like you can't just not treat it. But that's what the in-person boards were making students do. So I'm glad that they're doing mannequins now. Hopefully.
Or what was it? Patients asking for money to be.
Yeah.
I mean, there's some stuff, not great stuff with that.
Yeah, definitely. Do you have anything else you feel like is important to talk about in terms of how clinic works at your program? I don't think you mentioned, like, how often are you in the clinic? Do you guys assist at all?
Yeah, so we assist. We've been assisting for a while. They've been like just tacking on assisting requirements into our intro to clinic class. And so we've been in clinic since day one of walking into dental school. And even during COVID stuff, we were still in there. We just had a lot more PPE on in the beginning. And but it's been really good. And we've done assisting now quite a bit, and I think it's really been good to see how clinic is operating on like with a D3 or a D4, because it is a little bit different than, well, maybe not a little bit. It is still quite a bit different than like shadowing a dentist in a private practice. And we're going to be doing that. So like, I want to see exactly what kind of the constraints are and things like that. Like how many times do I need to check in with faculty, things like that. And then even like just knowing that like on a really busy appointment that you want to get a lot done, go to radiology like first, or like try if you can. And sometimes it depends on faculty if you're allowed to or not, but it really, if the patient, if you have to get radiographs that day and the faculty says it's okay, of course. But like, because the line for radiology can be pretty long sometimes, it's just one of those little like nuggets of information that you kind of lean on to. And then also just getting to know the D3s better. Really, really important, because they're going to be like our mentors in clinic when we are D3s and they are D4s. And that relationship is going to be pretty important, because they're going to give us, the lay of the land. They will be the higher ranking students there. So they'll be able to help us out with stuff, hopefully. So, and faculty, of course, but other than that, clinic wise is really good. So
do you assist like a specific D3 every time? Do you have to? Some dental schools are like that. And then others like mine, you just are assigned to show up and then you find someone, or how does it work?
They want us to be in our group practice clinic. So we have 8 group practices, and they each, or student clinic, whatever you want to call it, they're like each little dividers inside the new building. The new building is 2 stories, so it's separated 4 on each floor, whatever. So they just want us to assist a D3 in our clinic, which is very strategic, because that is going to be where we will be at, when we enter clinic, D3 year. So they want us to just start getting familiar with that kind of environment and those people. But also I kind of found myself really needing to fulfill those requirements like quickly, because I'm a little bit of a procrastinator sometimes. And with assisting, it was something that was like almost like fun and isn't really like something I was stressed out to do. So then near the end of the semester, I just kind of got a requirement, filled it anywhere. And no one really cared, as they were just happy I got the requirement done. But yeah. So you said you assist.
So
just, they tell you who?
So we have this like big schedule of like all of our rotations. Like I said, sometimes we work on each other, all these things, like all of that is on one master schedule, along with when we're assigned to assist in clinic. And it tells you which of the 3 clinics you're supposed to go in. And the plan is that you would just show up that day, ask around who needs an assistant, and go. But that doesn't really work for me. I would prefer to know who I'm assisting and what their procedure is, just so like I know what to expect. So if I do want to follow the schedule, I would like look up who's in that clinic that day, and you can see all the patients, like what procedure they're doing, which student is doing it, and what cube they're in the clinic.
Nice.
So sometimes I do that and I just reach out to people ahead of time. But honestly, I've found more value assisting the same few people that I feel like have more of like a teaching style when they're doing the procedures. And I've been assisting D4s a lot, which I think has benefited me the first bit of dental school, but I'm going to try to assist D3s more for that same reason you were saying, because the D4s are about to leave. So I don't want to like not have as strong relationships with the D3s once I'm in clinic with them. So I'll probably try to do more D3s and less D4s, but I tend to find the same people and assist them when it works, like with both of our class schedules and everything. So I don't always go on the assigned schedule either. They mainly just look at your requirements. I think they assign us just so that there are enough assistants in clinic for the patients, because a lot of times people just do the procedures without assistants because we don't have like paid assistants or anything. It's either like classmates, D1s, D2s, or you have the patient hold the suction and go by yourself. So I'm looking forward to trying to do more with the D3s. And also I'm going to try to assist the D4 a little bit more, whose patients I'm going to be inheriting. I've only
You already know that.
Yes, they tell us
That's
that.
cool.
So I've only assisted her one time. She definitely was like, yeah, come back whenever. But I just, again, was keeping up with the person I'm like genuinely good friends with and always assisting her because it was just easier. But those are a couple things I'm going to try to do also, I guess, to prepare more for clinic for the next couple of years.
Yeah, that's very cool. You know who that is.
Yeah. Do you have anything else you think is good for clinic to talk about? I guess we were going to talk about faculty shortages. I don't know if I feel that's more of an issue in our clinic than our pre-clinic. I don't know how it is at your school.
Exactly. It's the clinic side of it than the pre-clinic side. And the pre-clinic side is all of our mostly professors that have taught a lot of our courses the first 2 years. And there's no real issues there. I just hear a lot more from the D3s and D4s, but it sounds like it's an issue at several different places right now.
Lots of schools, yeah.
But yeah, it's just because, and for anyone that doesn't understand the context of it, the reasoning behind why it is such an issue, and it is because imagine it's faculty that is looking over multiple dental students who have patients. They can only handle maybe like, I don't know, here it's like 7 or 8 students at a time, one faculty for 7 or 8 students that are doing procedures, and they just kind of pop in randomly to make sure everything's going okay, getting checks and whatnot. And so the issue when even just one faculty, member leaves or retires, it then hurts 7 or 8 spots in the clinic. So that's kind of where I see a lot of issues with just dental schools in general. OSU, of course, I'm seeing it, or more hearing about it. I'm not really in the clinic too much, but yeah. Have you heard similar things? Did I explain that accurately?
Yeah, ours is actually pretty similar. Like you said, we have this like TV screen thing in the clinic, and on each cube, there's like the desktop where they do all the patient information. And then we also have a software where you request faculty so they know like which cube to go through. They have like a big board showing them who's waiting for them in order and everything. So that's a newer thing, I think, in the past like 4 or 5 years. How I mentioned we can do like a research project or electives. That was actually someone's research project, which is cool to like implement that into the clinic. But yeah, usually it's also tricky because you decide which faculty you want to request. So the favorites might have 12 people, and then the tough faculty might only have 2 students working with them. So part of it isn't like for us, our restorative faculty, like I was saying, for listeners, restorative is if there's cavities. Those faculty, we don't really have shortages of. And like I said, there are favorites, but I honestly think all of our restorative faculty is really strong, everyone that I've interacted with. And there might be kind of longer waits, but that's because people are choosing to work with like the favorite faculty. But where we see problems for us, where we have shortages right now, and it will hopefully get resolved. The school's like always searching for more faculty as people leave, but in the moment we have shortage of pros faculty. So that's when people are doing crowns, when people are doing dentures, they have to work with prosthodontists. And we would have one in there, maybe one in each clinic. And there's like 28 chairs. So there could be 20 people doing restorative and 8 that are doing pros, but there could be 17 doing pros and there's only one faculty. So like I said, our clinics, we have 3 and it's all D3s and D4s and they're at the same time. And you can be doing any type of procedure. You could be doing perio maintenance, working with perio. You could be doing restorative. You could be doing pros. And there's a few of each faculty in that clinic for that purpose. So it just kind of depends what the students end up scheduling. They don't like bring in extra faculty based on what procedures are getting done at that time.
That makes a lot of sense. And I think 2 things. One, I really hate to have favorites, but it's like one of those, it is a weird thing where you're right that you could be waiting a while if that is the case. We don't have a board like what you were describing at all. It's much more, I'm going to go find the faculty really quick and, pull them in for a second. But yeah, I mean, I think, the whole favorites thing is totally, it happens. And then the type of faculty that is not around right now, I'm not sure what exactly we're missing, but you're right that they are constantly kind of looking. And when I went to ODA, the Ohio Dental Association annual conference, they were looking for faculty there, and that's just one of the things that goes on. People move on or retire, or maybe they go back. And we had someone that moved just because they could. And yeah,
and you can't, to an extent, you can't fault the schools for it. They're individual people making decisions, and as long as they're seeking things out, there's only so much we can do. We're really at the mercy of our dental school most of the time. Once you sign up to go somewhere, you just have to go with the flow of whatever they tell you about how everything's going to work for the next 4 years. You don't get too much of a say in it. But I do think that one thing that people can think about is in possibly being motivated to maybe go themselves and be a clinical instructor one day when they're a dentist. I know we have a lot of faculty that just come one afternoon session a week. They work full-time private practice, but they come on Wednesdays from 2 to 5 or something. And even that is so helpful. So something for people to think about if you're listening and eventually going to be practicing, to give back to the dental school if you're drivable distance.
And I had a couple pre-dents reach out, and they were asking me questions about the faculty shortages and some other things. And when they asked me questions about it and they were concerned about it, I was like, there's a lot of other things to worry about. The first 2 years of dental school, I would I don't know. There's these issues will be likely resolved by the time you even show up to dental school. But it's just something that's kind of going on currently in this space. But so I really don't think it's anything for pre-dents for any of the schools to be substantially concerned about long-term. But it's just something that's going on.
Yeah. And you can't pick, if you pick one school because they currently have full faculty, that could change by the time you're in clinic or vice versa. So I don't think it should be high on your list for cons for a dental school.
Exactly.
More just ask about the actual clinical experience. How soon do you get to work with patients? How just how everything is structured otherwise, I think should be more of a consideration when it comes to clinical experience. Maybe if a school has been known to have not enough faculty for 15 years or something, okay, that's something to consider. But if it's off and on, and how I said, one department's really great, one department's missing a few people, that's going to be an hopefully easy fix.
Right. I agree completely.
So we talked about our overview of what we do for SimLab for 2 years, what we're going to do mostly in clinic. Looking back on SimLab, what has been anything that's been a big struggle? Because I know we both really disliked dentures.
Yep.
Is there anything that sticks out as was particularly hard, and how did you kind of work through it?
Yeah. So the first go around at indirect vision crowns. The first time I ever did those, that was something that you just had to figure out. And it was it took a lot of time. I remember we did D1 year, we did number 3, which is your maxillary right and right side molar. And anyways, just the nature of doing that indirect kind of vision crown. And for anyone that doesn't know what indirect vision is, that's when you're looking through the mirror and you have, I at least would have my loops on. And it was difficult learning how I was adjusting to learning how to use my loops at the same time of looking through a mirror and, obviously drilling a tooth. But that was a difficult thing. And then also recently, and I do not recommend this for anyone ever, don't if you can avoid this problem, just don't do it. But I broke my loops this last semester. And so I sent them in at the beginning of the semester for a repair. And it took 6 weeks before I got them back. So I was in SimLab I learned how to use, not use loops for, pretty much anything, and things were going okay. And then I brought the loops back into my mix halfway into the semester. And it was well, this is now I got to readjust back to loops. And it was just, I don't recommend it for anyone. Pick one or the other. Switching back and forth is not, in the middle of the semester at least, is not a great idea. And I learned that one pretty fast. But Yeah. What about you?
We still haven't, well, we've done like a crown prep on 14, but I haven't tried to do indirect really. I just like contort the head and like bend all around. It's so like that's one thing I should have mentioned before. I don't even think about it because I just avoid indirect vision so much.
Avoid it. Yeah.
I need to work on it more.
You're right. Number three, you can kind of move the head around in such a way that you don't really, I mean, other than the occlusal, probably. Yeah. Other than the occlusal.
Yeah, I need to work on it more though. And I know you mentioned like for people listening, indirect is looking through the mirror. What's tricky about it is like you're looking at the mirror and what in the mirror looks like you're moving right is like actually moving left on the tooth kind of. It's like opposite. And that's why it is confusing at first. So that's something for people to keep in mind, I would say, because it's and people ask me too, like, should I be practicing this ahead of time, blah blah blah, and no, like you have, that's what dental school is for, is to work on it. So I would just wait till you're in school and learn then, or be like me and still figure out a time to learn even though I'm finishing my second year.
That's okay. Yeah, don't stress out too much. Like those kits that were going around. Like I remember in our group me, our class group me. Yeah, you know what I'm talking about. Those kits where you're like practicing for dental school before getting to dental school. I don't know about that. Not for me. Not for me.
Yeah, I get the appeal and I get the marketability of that product, but at the same time, like you don't even know what you don't know. Like for the first couple weeks of my first sim lab, they're like, "Oh, see, like your surface is really bumpy." I'm like, "No, I don't see."
Yeah,
like I
don't.
literally don't know what you mean. But now I can look at something and be like, "It's 1/10 of a millimeter off." Oh no, and I can just tell with my eyes. So like you need the instruction and the guidance to know what you're supposed to know, and you won't get that till you're in dental school. So like you will learn, it just takes some time.
Isn't it crazy how I think when you come into dental school, you barely know what like a millimeter looks like, you know, and now they're giving measurements that are like, for crowns at least, sometimes it's like, we want you to do 0.8 millimeters. And like your range is between like 0.6 and 1, and we want 0.8. And it's like, now it's just crazy how your eyes have learned what even like 0.1 millimeter is like, I mean, just like a chamfer or anything like that. It's like, oh yeah, that looks about like 0.5 millimeters. It's like, gosh, that's just crazy to me.
Yeah, it's impressive. And it's even cooler to think that it's only been like 2 years or whatever, that we have like a whole career of dentistry. So it's optimistic to say we're going to improve in our skills even more and be able to learn like the more complex procedures and everything.
For sure.
So it is exciting. I would say though, to answer the actual question, I guess, like we were saying, just getting the vision down and like understanding what they're looking for in the grading criteria was a big adjustment first year. And that just comes with practice. And doing crown preps now, I found that they're pretty easy compared to restorations. And again, I think that's just because we do have that like dental eye now and we're more comfortable using a handpiece. But I definitely would challenge people to just practice as much as you can your first year. If you feel like you need it, like you really do know if you're prepared for a practical or your case of competency or not. I feel like you could practice 100 times, but if it's bad practice, it's not helping you. So I think it's important to be aware of how you're like mentally and physically doing, because if you're exhausted, it's not going to be good practice. So to understand when it's better to study for your didactic courses, when it's better to take a break, when it's better to be in sim lab, I just would recommend to people that good practice is more important than practice and bad practice. If it's just trying to get reps, I think it's better to just be purely focused and taking the time to critique yourself and go slow your first couple preps and restorations and really think about what you're doing. It'll pay off in the long run more than just burning through like 30 teeth and not really knowing what's going on.
Yeah, completely agree with that. It doesn't always take 30 teeth, you know.
Which actually for me, it never really did. No. I think we only get like 10 of each one and then we have to buy more or something. So.
Well, you figure out if you're doing that many preps, if you're like really going like crazy for a practical, one, you're going to stress yourself out, obviously, kind of a substantial amount. And then also, like, what else are you, kind of what you were mentioning, what else are you putting to the side, like didactically? So, yeah.
And if people are wondering, like, what happens if you don't meet the criteria, if you fail a competency, or in my case, practical. So at our school, it's called remediation. It applies to lectures and sim lab. I think it's pretty uncommon to have to remediate a lecture usually, but for sim lab, for us, they do all of the remediations at the end of the semester. So you might have like 5 different practicals throughout the semester, usually like 2.5, 2 or 3 weeks to work on a skill, have a bunch of projects and different teeth you're working on for that same type of restoration or crown prep. And then you have a test on it where you do the one tooth, it's timed, they're going to grade it. And if you don't pass that, you redo it at the end of the semester, which is different from program to program. Some schools you might do it like a couple weeks after, but I kind of like that we do them all at the end because it gives you plenty of time to practice it. And you really shouldn't be so stressed about it now because you've had like 2 more months or another month to work on it. And if you really work on dental skills for that long, you should be able to get it down, especially like if you were thinking about what Joe and I were saying about having good productive practice.
Yeah. And with our school, it's remediations is a little bit different, but the same idea, but the one thing is recently what they've been doing is it's been changing almost every semester. And I don't know if that's because of COVID or if it's because of the academic years that we are in. But like, for example, like I know that the next round like of remediation isn't until like the summer. So what like is happening is even if something like went wrong in the fall semester, like you're going to be still expected to take like the competencies and stuff to get into clinic in the spring. And then in like late spring, early summer, you'll remediate anything else that has not been passed so far. And then you'll be officially in clinic, after that point. But I think there's like different like levels of it too. Cause like sometimes though, like I think like D1 year, it was like in the summer as well, but it was like you had several weeks where like you were going in and practicing and you had to pass 2 preps of whatever the practical was. And then the third one was like a test, like a mock test. And then that one was like to basically test out of the program. But yeah, each one is different, but the faculty kind of explain what is expected, right before you start it. And it's, the expectations are usually pretty clear and you have quite a bit of help. So like, I think we were talking about it earlier, maybe before we started recording, like they want us to pass. So like, it's one of those things that, they do want you to keep moving along, to keep progressing. And there's all these little like fail safes that like are in place to make sure that you keep moving along. And, and it doesn't just because, we can talk about this forever, comparison and whatnot, but just because your hand skills might not be as perfect as someone else doesn't mean you're doing dental school wrong necessarily. It just means that it might take more time for you to coordinate, what's on the paper and putting it on the tooth, getting the prep that is supposed to be ideal. But everyone's very different. So it's just one of those things you got to be comfortable with knowing where you're at and how much time is it going to take to pass and still, do well didactic classes wise.
Yeah, everyone's so different and there's no shame or also like reason to boast if you're amazing or if you're not amazing right away. Like either way, everyone will pass eventually. Everyone is going to get to the same point. It just depends how much practice it's going to take you. And having more practice is certainly not a bad thing. There were a lot of skills first year that took me more practice than my peers, but there's also been a lot of skills this year that I haven't had to practice so much and maybe other people have. So there's different things, whether it's didactic or clinical, that you're going to excel at and others that you're going to struggle at. So it's not, like you said, worth the sweat of comparing yourself because everyone has their different strengths and you'll find your strengths as you go through dental school. So definitely try not to get too discouraged, like you said.
Mm-hmm.
So we're getting close to time here, but before we wrap up, at the end, I wanted to talk about kind of our goals for D2. But before that, is there anything you want to just put out there for like pre-dents? I know people are probably listening because they're interested in Michigan or Ohio State. So is there anything about your program that you'd like to discuss a little bit more?
Oh, yes. So recently there hasn't been all of the applicants that have applied to, Ohio State. There has not been a tour of the school, which has been a big concern for even the people that are getting accepted, because a lot of the other programs, they've been giving tours and stuff. But basically we're now going to be able to bring back pre-dental day and all these other things. Going forward, I'm hoping it shouldn't be an issue, but it's just, speaking, the truth here that like the dental students we want you guys to have a tour of the school. Like, trust me, we do. It's just not something the dental students get to choose for you, right? It's all about the admissions faculty, not even faculty. It's just the admissions group, the people that decide, who's accepted and whatnot, is like not able to give the tours right now. But yeah, I'm sure they will be back. And with pre-dental day, at least, I know there's going to be tours of the new clinic and whatnot as well. But there's also online videos and stuff. I know that's no substitute for not getting the, come in person, but just saying that it's not something to do with the dental students. Like we definitely want everyone to experience the school in person as well. It's just something that hasn't been able to happen since I actually applied. I think I was the last tour that occurred during interviews, and you were too, because I know you interviewed here. But yeah.
I think too, to not get too wrapped up and not getting to like walk the halls of a school, because for me, I did have that opportunity and I do feel lucky to get to have physically seen the schools I was accepted to. But what I enjoyed the most about those days is the conversations with the students and getting to see how they really felt about the programs. And that's something that you can still seek out as a pre-dent. Hopefully the school is putting on some kind of panel for you during the interview, or you can take initiative and use social media. Like if you looked up OSU, you could have found Joe and asked him some questions about the program, for example. So I think that that's almost more of a testament to what a school is going to feel like to you, is how the students seem. And if you feel like you connect well with them, that should also help you really get a feel for a school. And I mean, just from an outsider's perspective, if anyone is considering Ohio State, I did tour there. I did love the program, and I didn't even get to see the new clinics because they weren't up and running yet, but I still thought it was an awesome school. So that's just another boost to OSU if you are considering it. I do think it's a great program. My school is Michigan, and like you said, they did online interviews, but this past like couple months, they have been bringing in those accepted students and letting them tour the school on like a Saturday. So there's been a few Saturdays when people get to come in and see. And same thing, like I've been talking to a ton of pre-dentals and accepted students, just giving them my perspective. So I think the best thing you can do as a pre-dent, if you're deciding between programs, is just talk to as many students as you can. Honestly, I think one student really isn't enough because everyone has such a different experience. And I might say I love something and I dislike something else, and someone could tell you something totally different. So it's good to get a wide range of opinions and then kind of sit with that, think about it, and see what you can take away from that kind of as a whole.
And probably no program is going to be perfect.
Exactly. Yeah.
I mean, so there's going to, like, if you're really hunting for something to find a flaw in, you're going to find it somewhere with almost every program.
Mm-hmm. So just to wrap up, is there anything that comes to mind for this semester? We kind of talked about that we both have busy semesters and you're going to be in some tough classes, but is there anything goals wise or just balance wise that you're focusing on this semester to get through?
I am still trying. I think I'm going to stop using certain study methods for certain classes. So, and what I mean by that is just like, if I was using Anki for a class, I might now shift that to a study guide or something. just because I've learned that just flashcards just take forever. But say like when it comes to pharmacology, like there's a good chance that we might be doing flashcards for that. But other than that, just staying balanced like in that way. And then also I don't want to give up my volunteering activity that I like to do. That's kind of a personal thing that like on Monday nights, like I don't do dental school normally, like ever. So unless if something really weird happens and there's a practical Tuesday morning, but that's just one of those things that I just is a non-negotiable for me. But yeah, other than that, just I have to figure out still if I want to go in person or if I want to stay like more hybrid, because we kind of have a little bit of a choice. All of our lectures are recorded, and I am honestly still trying to figure out what I like. And it's not something that maybe some classes I will just know right away that I need to be in person. But I feel like every semester is a big adjustment just with the workload and stuff. But other than that, just still making time to go into pre-clinic and practicing for competencies. Probably for me, it's in the evenings because I don't really care to study that much late at night. So I can go in and practice hand skills at like, I don't know, 8 p.m. or whatever. So what about you? What are some of your goals for staying balanced?
Yeah, I definitely am a morning studier as well, if I can be. Like I am the most alert in like the early part of the day. So I agree that that's when I would like to do work. And I think that it's a good reminder for people either coming into dental school or that are currently in dental school that both of us, even though we've been through so many semesters, are still always adapting our study techniques and our ways of going about the week. But at the same time, we found a few things that work for us. Like you said, your Monday nights are just for you. And same for me, I try to take at least one day off a week of everything, whether it's a weekend or whatever. But I'm going to try to keep up that same kind of thing. And our classes are going to be in person. So I don't really know what to expect as in terms of like adjusting. Hopefully it'll be good. Hopefully I'll learn more because I'll be more forced to do the work. So I'm hoping for the best, but I think it'll be a lot more exhausting because you do have to come back and then study everything that you took in a lecture versus kind of pacing yourself. So it'll be interesting. I really don't know what to expect, but I'm really just trying to get through it and go into it with an open mind and keep trying my best. So it's, I guess for the people listening that are dental students, it's totally okay if you're kind of pivoting all throughout dental school. Like I still feel very comfortable in dental school now. I feel settled in, but at the same time, things are always changing and you just become so comfortable with craziness and with exams all the time. It just doesn't really phase you anymore. So that's something I guess to look forward to. Hopefully you'll become more at peace with the hecticness of dental school as it goes.
One semester at a time. Also, I have learned like I can't think about too much. Like I know we talked a lot about D3 year and stuff too, which is fine, but it's like at like the core, you really just worry about the semester you're in or the next one, whatever. But yeah,
I agree. Which is why I said sure, it'd be great to do these things to prepare for clinic, but we really just focus on all the classes and all the pre-clinic that we have right now. Totally agree. Well, thank you so much for your time. I do got to get going to get to class soon, but thank you so much. It was good chatting with you again. And
of course.
Do you want to shout out your Instagram one more time in case people don't know?
Yeah. If you want to connect with me, you can follow me at Future Dentist Joe. And my DMs are always open if you have any questions or anything like that. And let me know if you need anything.
Thanks for your time again.
Yeah, thank you.